In this video, I would like to introduce you to the topic of gastrointestinal stasis in rabbits. Gastrointestinal stasis in rabbits is a critical health concern where pet owners can find their rabbits to have stopped eating and stopped pooping, and the rabbit can also be found in pain in a hunched over position. This is an immediate cause for concern, as this means that the digestive system is undergoing a slowdown or has completely stopped. Gastrointestinal stasis can be very severe and life-threatening to the rabbits, thus it requires fast veterinary intervention. Let's take a closer look at the causation of gastrointestinal stasis in rabbits, as several factors can contribute to this onset. I will summarize three main causes: improper diet, disease, and environmental influences. Rabbits can get an upset digestive system when they are eating too much carbohydrates, such as pellets, treats, or fruits and vegetables, and not enough fiber, such as hay and grass. A rabbit's gastrointestinal system heavily relies on a constant influx of fibrous materials to function optimally. This figure on the right summarizes this proper diet of a rabbit. Another factor can be insufficient water intake, as dehydration can also impede the movement of food through the digestive tract, which can cause issues. Another contributing factor to gastrointestinal stasis can be disease. Rabbits that are sick with other diseases may also have a decreased appetite. An example of this include kidney disease or dental problems, of which two pictures are shown on the left and middle of the screen. Bacterial, viral, or parasitic infection may also increase the risk of developing gastrointestinal stasis. Looking at the infection with E. cuniculi, this is a microparasite that can infect the spinal cord and subsequently cause poor contractility of the stomach. A picture of a rabbit suffering from this parasite is shown on the right. In turn, the poor contractility of the stomach can also cause stasis. Lastly, rabbits are also quite sensitive animals, so an excess of stress, pain, or obesity may also lead to rabbits to stop eating, and again, in turn, that could increase the risk of eventually developing gastrointestinal stasis. So what exactly happens in the rabbit's body that makes gastrointestinal stasis so dangerous? This mostly has to do with the bacterial composition in the intestines of the rabbit. Rabbits that do not eat undergo a pH change in their intestines that favors the growth of gas-producing bacteria. And when these bacteria proliferate, they produce painful gas that makes the rabbit want to eat even less. And these bacteria may also produce toxins that, if untreated, not only make the rabbits feel sicker, but also lead to organ failure and death. And this increase in gas production can really be seen on the outside too, in the rabbits. You can see a very bloated stomach, which is also kind of visible in the picture shown on the screen. You see the rabbit with a kind of bloated belly. In order to diagnose a rabbit with gastrointestinal stasis, radiography is highlighted as the most important diagnostic tool for evaluating the gastrointestinal tract and monitoring response to therapy. In an X-ray, abnormal findings such as gas accumulations, stomach or intestinal impaction, and obstruction can be visualized, and this is a very important tool for diagnostic workup. And also looking at how the rabbit presents and the type of poop it produces is very telling for how the rabbit is doing and how severe the state of gastrointestinal stasis is. as also I mentioned before, a very bloated stomach, which can be seen on the outside too and can be felt, is also an important part of the diagnosis. The management plan of treating gastrointestinal stasis may include the following components. To start, fluid therapy is very important, as dehydration is often a significant concern in rabbits with gastrointestinal stasis. So intravenous or subcutaneous fluids may be administered to correct this fluid imbalance and provide supportive care. Then pain management and the providing of other medication is also crucial. Pain relief is essential for the well-being of the rabbit, so opioids or other pain management medications may be prescribed to alleviate the pain and discomfort. And other prokinetic drugs, so drugs to induce movement in the intestines, may also be given to promote the motility of the gastrointestinal tract. Next, feeding support may also be helpful. So hand feeding or syringe feeding can also help to maintain an essential nutrient intake, and this may be necessary until the rabbit resumes eating independently. For future treatment is fiber supplementation also very important, so increasing the fiber content in the diet to promote normal gastrointestinal motility. This can be easily given by providing enough hay, which is a high fiber forage, and it should be provided in abundance. And lastly, it may also be necessary to address underlying causes, which also could have caused the start of gastrointestinal stasis, such as the dental issues or a disease may be treated to stop gastrointestinal stasis from happening further and prevent it from happening in the first place. The prevention of gastrointestinal stasis should always be the main priority, as it is not very difficult to decrease the risk of the development of gastrointestinal stasis at all. It's most important to start implementing measures to ensure the rabbit's overall well-being, and this includes providing a well-balanced, high-fiber diet, ensure access to clean water and fresh water at all times, to promote regular exercise and create a stress-free environment for your rabbit. Regular veterinary checkups can also help identify and address potential issues before they escalate in the future, and one example of this could be the dental issues. That would in the end conclude my video over gastrointestinal stasis in rabbits, and this last slide gives an overview of the resources I used to make this video. Thank you for watching.